may not employ a licensed professional, limited permit holder, or intern.
Okay. What information, David, do corporations need to provide in order to apply?
Well, they need to give us some basic information. The first would be what professional services are they going to provide? Is it going to be licensed master social workers, licensed clinical social workers, creative arts therapists, psychoanalysts, marriage and family therapists, mental health counselors, psychologists? They need to tell us or affirm to us that only individuals who are licensed under the education law or people who are authorized, like a student intern under supervision or a limited permit holder, will be providing the services within that organization in that setting. They also have to attest that they have sufficient resources so that they can provide services to individuals, and that they will maintain in a secure manner the records of patient treatment, just as would be required of a hospital or a clinic or a private practitioner, so that the consumer has the ability to access their records and information about the services they received. And the law also requires that each member of the board of directors of an organization be of good moral character. So in the application, we ask each director to submit an attestation that they're of good moral character, or to report any arrests or convictions or loss of a professional license, something that might raise a question about the ability of the director or the organization to be able to provide services to the public.
And is there a cost associated with the waiver application?
There's no cost for the application, neither for the initial application nor for any additional certificates for settings where the organization provides services.
And how long is a waiver valid for?
The waiver is valid for 3 years. So just before the 3-year period ends, we will be sending out a renewal notice to these organizations so that they can provide us with updated information. And they can add sites, they can add services if that's what needs to be done at that point in time.
Now, given the fact that the department is going to be screening and issuing waivers to certain corporations, how is the department ensuring public protection under this waiver process?
Well, when we went and met with the associations and when we met with the legislature, everyone's discussion was focused on two things. One, the organizations that are providing services, just like licensed professionals, 99.9% of them are doing the right thing. So we're not doing this because we think that there's nefarious activities going on, but we still need to make sure that there are provisions so that if there are organizations, or if they're just like if there's a licensed individual who's doing something wrong that harms patients, places the public at risk, that there's consequences and accountability for that. So that an organization that gets a waiver would be subject to oversight by the Board of Regents, just as a licensed professional would be subject to discipline, and the organization would have the same rights as an individual. So it's a due process protection as well as a public protection process.
Okay. Does every not-for-profit or educational corporation need a waiver?
There are certain organizations that do not need waivers as they're spelled out in the law. For instance, you've got organizations that have an operating certificate from the Department of Health to operate a hospital, or from the Office of Mental Health to operate a clinic, the Office for People with Developmental Disabilities to operate a group home, the Office of Substance Abuse Services, or from some other government organization that issues an operating certificate. That tells us that organization is already under some sort of oversight and scrutiny, so we don't need to be issuing a waiver for them. There's also organizations that are called university faculty practices. There are separate provisions in the not-for-profit law that are tied to hospitals. They don't need a waiver. A college or a university that educates individuals to get licensed in the social work professions, the mental health professions, psychology, medicine, or nursing, again, their students are going to be providing these services. They're going to be so that they don't need a waiver to be able to have the students complete those internships or those placements. And then finally, one of the things that was not clear in any part of the education law was the role of counseling centers on colleges and universities' campuses. So we clarified that college can employ licensed professionals to provide counseling services to their students or to the family and the staff.
Okay. This corporate practice issue has affected a number of individuals who were working toward completion of their supervised clinical experience and in pursuit of their professional licensing. Does this law do, what does this law do, if anything, to assist folks that thought that they had qualifying experience?
Well, as Karen said, there were a lot of people didn't realize that this was a problem when they took a job, when they started working under a supervisor. They acted in good faith because in many cases their supervisor had gotten their experience in that same organization or that same setting. So the law actually has language that says we can accept good faith experience that's completed by an applicant who thought the setting was qualified. And that means that the individual doesn't lose whatever time they had put in there toward their clinical experience. There's also provisions that allow us to assume that an organization or an entity right now is acceptable until they actually get the application in and we complete the review of the application. Rather than saying, well, hold off, you can't provide services, we're trying to let these organizations continue to provide services because, again, 99% of them are doing the right thing. They're supervising students, they're supervising new licensees, they're getting good experience. But going forward, one of the other big pieces is, for social work especially, we've now created what we call a Form 6, which is a prior review of a proposed setting or a supervisor, so that someone who's an LMSW who wants to get their clinical experience could submit the application to us, and we'll look at the setting and the supervisor to just verify that it is an authorized setting, so that person knows that they're putting in the time in an appropriate setting and place to get the experience that they're going to need to get licensed.
And folks applying for a limited permit in multiple professions,
right,
also have to get their supervision
and this would be
approved.
Another way for that setting and that supervisor to be looked at.
Great, great. Karen, what should non-for-profits be doing right now to make sure that they're complying with this law?
Well, right now they should be reviewing the certificate of incorporation. They should verify that the purposes stated include the provision of social work and mental health services as defined in law. And if it is not clearly stated, they should consult an attorney to determine if the corporation requires a waiver. If necessary, apply for the waiver with the Education Department within the 120-day application period.
Okay. And where can someone get more information about the waivers or supervised experience requirements for licensure?
All of the applications and the information, including the law and the regulations, are on the Office of the Professions website. The education law to the regulations that define the application process and the application forms have been posted up there as well.
Wonderful. Well, Karen and David, thank you so much for sharing your expertise with us today, and we'll provide you with the Office of the Professions website. It is the host of all information related to this issue. Thank you for joining us, and have a good day.